Hey, what's up? Rohit Smetana here with another short video to help you better understand and treat acne. So, in the last two videos, we looked at whether some racial groups get acne more easily than others. And we found that most differences in acne between races are probably due to differences in lifestyle and diet and rates of overweight, and not due to physiological or genetic differences between races. However, there is one difference independent of diet and body weight, and that is how strongly different racial groups are affected by sequelae of acne, which are damages that result from acne, such as scars. And another sequelae that we're going to look at today is post-inflammatory hyperpigmentation, which is a darkening of the skin in the spot where a pimple or cyst was. And this affects dark-skinned people, such as blacks and Hispanics, more often than light-skinned people, with about 2/3 of black women in this study developing hyperpigmentation and about half of Hispanics, whereas only about 10 to 25% in continental Indians, Asians, and whites. Now, hyperpigmentation can also be seen after other kinds of skin damages, such as burns or other inflammatory diseases such as dermatitis. And with hyperpigmentation, it is important to start the treatment early to be most effective. Ideally, though, you prevent the hyperpigmentation to happen in the first place by treating the cause, which here is acne, as early and as effectively as possible. For that, you can check out these videos where I explain the best treatments for acne, including diet, skincare, supplements, and medications. In today's video, though, I'll address how to treat post-inflammatory hyperpigmentation once you have it. So let's get into it. First off, since the spots oftentimes get even darker when exposed to sunlight, it is important to apply strong sunscreen when being out in sunny weather. And then to treat hyperpigmentation, your doctor can prescribe different topical depigmentation or bleaching agents. Typically, treatment starts off with hydroquinone and is combined with other agents for increased effectiveness. However, since there is some limited concern about a possible cancer-promoting effect of hydroquinone, I would start off with alternative substances, and if hydroquinone ends up being necessary, just choose the lowest effective dose and duration, simply to minimize any potential risk. There are numerous other substances that can be used as alternatives to or in combination with hydroquinone, including the vitamins C, B3, and E, retinoids, which are a group of substances related to vitamin A, some common foods or extracts of them, such as licorice and soy, that are also applied topically, different organic acids that are often abbreviated with AHA or BHA, such as the fruit acid glycolic acid or kojic acid found in some mushrooms, or azelaic acid, which comes from certain microorganisms. And finally, there's R-butene, which is a natural molecule similar to hydroquinone found in bearberry leaves. Now, these substances fight hyperpigmentation through one or several of the following mechanisms. They might block an enzyme called tyrosinase, which catalyzes the formation of the skin pigment melanin. They can also reduce the building blocks needed for melanin production, or inhibit the proliferation of melanocytes, which are the cells that produce melanin. And finally, they might inhibit melanin transportation from the melanocytes to the surrounding cells. Now, in contrast to hydroquinone, some of these substances, such as licorice, might actually be protective against cancer. And also, many of these same substances, especially retinoids, as well as vitamin B3 and potentially vitamin C, also happen to be highly effective against acne itself. Glycolic acid and other organic acids can also be helpful in the treatment of acne, especially as a peeling agent. So you might want to start out with these substances first to treat two problems at once, the hyperpigmentation as well as the underlying acne. Again, that's retinoids, vitamin B3, vitamin C, and organic acids such as glycolic acid. And just to be clear here, all substances, including the vitamins, are used topically. That means on your skin, not internally like a pill. Now, depending on where in the skin the damage occurs, the hyperpigmentation can be in an upper or in a deeper skin layer. And in the deeper skin layers, it tends to be more permanent and much harder to treat. For deeper or more persistent hyperpigmentation in general, more intense treatments might be applied, such as laser therapy that destroys melanosomes, which are transportation vehicles of the melanin pigment, or chemical peels, which peel off the upper darker skin cell layers. And those chemical peels use different organic acids, such as glycolic, salicylic, or lactic acid, in much higher concentration than regular skin bleaching products. After chemical peels, sunscreen is especially important since you remove the upper darker skin cell layer and thus leave the skin more vulnerable to sunlight-induced damage. Laser therapy and chemical peels are both rather intense procedures, which is highlighted by the fact they're listed under surgical therapy. Therefore, I'd suggest careful consideration with your dermatologist. I want to stress here that all mentioned treatments should be used cautiously and under the guidance of a healthcare professional, just to minimize any risks, including skin irritation, worsening of the hyperpigmentation, and other side effects. And some of these substances can have severe side effects. As with all medications, special caution should be taken when pregnant or trying to become pregnant or when breastfeeding. Some of these drugs, such as hydroquinone, meconol, as well as some retinoids like tretinoin, must, for example, be avoided by pregnant women to avoid damaging the fetus. In this context, I also want to mention that hyperpigmentation is not a physically harmful symptom, although it can, of course, have strong negative psychological effects. So it doesn't require treatment as long as it doesn't bother you. Besides hyperpigmentation, it is also possible to suffer from hypopigmentation due to acne, which are not dark spots but light spots due to reduced production of the skin pigment melanin instead of increased production. Now, hyperpigmentation is again most pronounced in blacks and can actually be caused by a flawed treatment of hyperpigmentation, which is another reason why this should be done under the guidance of a healthcare professional. The treatment methods for hyperpigmentation are more limited, but usually the spots will darken to the natural skin tone over a few weeks or months anyway, just with normal sun exposure. This goes for hyperpigmentation caused by acne though. Treatments and results for hyperpigmentation caused by other diseases might be very different. Alright, this is it for today. Other sequelae of acne, such as scarring, will be addressed in another video. If you have any questions regarding acne, be it regarding this video, skincare, nutrition, medication, whatever it is, please post them in the comments below and I'll do my best to answer them all. Also, if you'd like to learn more about acne and get a clear roadmap on how to treat it most effectively, you can check out my book, linked in the description below, or get a personal counseling session. Thank you so much for watching. See you next time.